first, and then we go to I'm going to share the slides. So it should start with the first one. And so I should share it one more time because I would like you to see it in full screen. So I think you can see it full screen now, right?
Yes.
So today we are going to continue speaking about presenting complaints by the patients. And so first, let us just focus on the assignment that you have done, that you did before this class. And so you remember that you were given vocabulary exercises to complete. The exercise where the task was to write the parts of the bodies, some prepositions. The most difficult task was number 2, exercise number 2. So because some of the students didn't understand the idea of the sentence, but you remember that the first sentence was about the person with some specific disease. Do you remember what disease this sentence describes? Is it angina? Do you remember? I guess it was angina. And so angina pectoris. So it's connected with the problems in the heart and in the chest. So some pain in the chest. That is why we should, you can see the sentence that you should have written, or the words that were missing in this sentence. As you see, it's like a tightness across my chest. And it goes up into my neck. The preposition into was missing. It should be like into my neck or into my jaw and into my left shoulder and down the left arm. So this is the correct version of this sentence. And the sentence B should be like it starts in the loin and goes into the groin and down into the testicle. So this is the way it should be written. So most of the students have done it correctly. Yes, most of the students have got just maximum score for vocabulary exercises. And you can see this these grades on Universite. So, and I've also graded the grammar exercises task. And you can see your score out of 10, which is maximum score. You can see your score on the Moodle side, but I haven't transferred grades to the Universite yet. So I'll do it this week later. And as for the grammar exercises, you can see here some examples of the sentences which were done, which were wrong. So you remember that the grammar exercises were about direct and indirect questions. And so first of all, we should understand whether the question is direct or indirect. So, just put the words in the correct order. Like here in the second sentence, for example, one of the students has written, how far is the airport? Or how far to the airport it is. So it is wrong. First, you should use the verb is and then the subject it. And so yes, like this, how far is it to the airport? We can also say how far to the airport is it? But it's better to use airport at the end of the question. So it means that the direct question should have like the verb first and then the subject, is it? But when we speak about the indirect question, here it starts with the do you know? This is the question itself. And the student has written, do you know what time will you arrive tomorrow? The student uses will first, the verb, and then the subject you. This is the the order of words that is used in the direct question. As far as this is indirect question, you should change it, like, do you know what time you will arrive tomorrow? So this is about grammar, yes. And so just a couple of more questions here. Also, there is an example of direct question. How long have they been married? So have the verb have as an auxiliary verb, then there is the subject they. It's okay. I mean, this sentence is right. And because this is direct order of words in the question. I mean, the direct question. But when we change it with the help of do you know, we should also change the order of words. First, we use they, and then the verb. They have been married. So this is the way we should just use, we should place the words in the direct and indirect questions. Do you have any questions about this task? No, I see.
No, teacher, everything's okay.
I see, okay. Now,
I have a question.
yes?
How did you calculate the grade? Because I look at my grade and didn't understand.
What's your name?
Ammar Ali.
Amar, just a minute. Amar, so you've seen your grade, right? Amar,
Yes.
on the Moodle site, and you see that just only one sentence is correct, right? You can see the correct versions of four sentences here actually, out of 7 that were given. Well, yes, unfortunately, I don't have this file here open. So you may write to my WhatsApp just number in person, and just I'll write you the question, the correct version of the question. Okay.
Okay.
After the class, please. Well. And now we are going to speak. Speak about the people working in medicine. So we are going to read about Dr. Henderson, a cardiologist. And first of all, let us just think. Let us try to answer this question, if we know. What has being a cardiologist involved? Being a cardiologist. Who can answer this question? Abdel Rahman?
Being a cardiologist involves heart surgery or heart exploration.
Okay. So Emma, Eman, would you like to say anything about this?
No, I was going to answer the same what he said.
I see. Okay. So this is cardio means heart, right? So now let us read what Dr. Gillen says about her job. We're going to read, so try to understand and remember the information. Then we're going to just discuss some facts from the text. Well, let us listen to Hussam. Read the first paragraph, please. Hussam, are you here?
Yes, sir, I'm here.
Start reading, please.
Dr. Gillian Henderson. My name is Dr. Henderson. I'm cardiologist at London Hospital. The higher trained team of which I'm about deals of diagnosis, investigation, and treatment of patients with form of heart disease, including the cardiac transformation of some supports of vessels diseases.
Okay, will we stop here? So we can see this is about, so she answers this question about what just the job of cardiologist involved. And we see that there are some just medical terms like cardiac transplantation. So I think you understand the meaning of this phrase, and vascular disease. What kind of diseases are they? Vascular. Relating to what?
Heart attack, maybe.
Yes, to heart, relating to vessels, right? Okay. So the next piece of information, the next paragraph is for Amar. Amar, read it, please.
So teacher, from where should I read?
The second paragraph, starting with none.
Okay. None of our work would be possible without the support of other people in the hospital team, the triage nurses, the receptionists, and so on. Their work is vital to the smooth running of the department. When patients arrive for the first time, personal information is taken: name, address, telephone number, next of kin for contact in case of emergency, and other information such as their GPS name and address, their NHS number, and their unique hospital number.
So here we can see two abbreviations like GP. Do you remember the meaning of this abbreviation? What do the letters stand for? GP. You can help us? We were speaking about this last week.
General practitioner.
Exactly, general practitioner. And NHS, this is for National Health Service, National Health Service. And yes, I would like to be sure that we understand this phrase when patients arrive for the first time. There is a phrase, next of kin for contact. What does it mean? What does it mean, next of kin? What is the synonym to this phrase? Who knows? Next of kin. No one. So actually this is relatives. So the relatives of these persons, the people who are close to this person. Well, good. And the next piece of information. Yes, let us move on. Let us listen to to Anorim, please.
Yes, we deal with a large catchment area and also deal with referrals from Saudi area, tourists, visitors to A&E, private patients, and so on. So the potential for confession is great unless the data that are taken are accurate and system secure.
Okay, let's stop here. And here the abbreviation AND. What does it stand for? So if there is an accident, for example, in the street, and some people are injured, A&D just comes, they come first to help these people. So this is accident and
Accident and emergency.
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 Yes, accident and emergency department. Okay, and so this is the information about the people, so who the doctors help. And the next piece of information is for Isar.
Yes. At various stage of patients' contact with the hospital, information is checked to make sure it is correct and that the patient can confirm their identity. For example, on arrival at the clinic, patients might be asked their GPS name or part of their telephone number. For example, the last three numbers.
So this is about checking the accuracy of information. Well, and the last piece is for Abu Ali, please.
Okay, teacher. Then during the consultation, a nurse or a doctor might also ask their date of birth. All this is for the benefit of the patient to ensure that the hospital team doesn't make mistake and the people don't use patient details frontality. We can then turn to dealing with the patient treatment is safety.
So the word fraudulently. So fraudulently means just involving deception, just giving the wrong information. Well, and so we've read the story, and now there are some, there is the task here. So all the statements given here on this slide are true. We should find information in the text to support each statement. Yes, Emma?
The first question answer is true. So the paragraph from the paragraph, he said that. Can you wait a second?
You mean
that his team doesn't make any mistakes and the people does not use patient details in a bad situation for bad reason.
okay. I mean, so I've sent the book to you. Can you see the text in front of you? Do you have the text?
Actually, no, but I have the text in my laptop, but not your Zoom. Like I am seeing the text in my device.
So you can see the presentation, you can't see the text, right?
Yeah, I can see it.
So
because the answer is because the patient to ensure that there is no mistake and people do not use patient details in the bad situation. This is the answer.
I see. And so Hussam was just raised the hand, right?
No, I raised it in the first one, which I read.
Tariq would like to read the next sentence.
Yes. The work of her team depends on the support of other people. It is in the second paragraph
Okay.
where she says, none of our work would be possible without the support of other people in the hospital team.
And what are the people?
What, doctor?
What kind of people work in their department?
Yes, the triad nurses, the receptionists, and so on.
Okay. So let us listen to Mohammed Ali. Sentence number 3.
Yeah,
Yes, read it, please.
details about the closest relatives are taken from patients.
Mhm.
No, they didn't mention that in the text.
So where is the information here that can just support this?
They didn't mention information about closest relatives.
So here it is. When patients arrive for the first time, personal information is taken. So
Yeah, personal information. His information, not his relatives' information.
I mean that there is information. There is the phrase next of kin for contact. This is just it means the meaning of the phrase is relatives, right?
Yeah,
So
maybe they can take their parents' number or one of his relatives just in case to contact in any emergency case in the hospital.
exactly. Okay. So and the next is Noha. Will you speak louder, please?
Patients have two numbers other than their phone number on their hospital records.
And what does
They
the
have
yes the text say about this?
in the second paragraph of the text, they have their NHS numbers and their unique hospital number.
And the sentence is about phone numbers. So other than phone number, yeah, you're right. So this is the numbers. Okay, so the next sentence is for Rufaida, please.
The data collected need to be accurate. In the third paragraph, it was mentioned that the potential for confusion is great unless the data that are taken are accurate and the system secure.
Exactly. And the last sentence is for okay, Tariq. Tariq, are you here?
Told us that he's gone for 5 minutes. And
I
he's not
see.
back.
Emma, please, number 6.
Yes. Okay. That's true because the clinical patient might ask their GP's name or part of their telephone numbers, for example, the last 3 numbers, and confirm their identity.
Okay, yes, just to be sure. Okay. Well, this is the information about the work of Dr. Gillian Anderson, and let us just focus on some details about presenting complaint by a patient PC, which is one of the basic just phrases just which is used by doctors. So I mean that there is the difference in the use of this term in different countries. For example, in Europe and in Canada, the doctors use the term presenting complaint, the history of presenting complaint, for example, when they just write down the information about the patient. But in, for example, the United States of America, the term is different. This is chief complaint. So, I mean, if you just meet these terms in some literature, you should know the meaning of the phrase. And the meaning is the initial concern which brings a patient to a doctor or the reason for which a patient approaches the doctor and the information that the patient gives to the doctor. Well, and now, in presenting complaints, doctors use Socrates in the history of the presenting complaint to help them remember the main questions they need to ask about pain. I mean, this is the model that is used to memorize the questions that should be asked by the doctor and the order of questions. So you can see the model is called Socrates because this word goes crossed down, and each letter of this word just means stand for some just specific question which should be asked about the pain that the patient has, So for example, the first letter S stands for site, so site of the pain, so the location of the pain. Then there is onset. This is about when the pain started. Character of pain, so how severe is the pain? Is it just acute or dull or something like? We were speaking just about the character of pain, which adjectives we can use to describe it. Then about radiation, whether the pain moves to any other parts of the body. Associations, this is about the triggers, for example, what can cause the pain or what else goes together with pain. Timing is for how long it lasts. Exacerbating and alleviating factors. Exacerbating factors are the factors that just make the pain worse, and alleviating, on the contrary, the factors that can make the pain less severe. And severity, how severe the pain is. So the question, what are the questions that a doctor asks about pain? So I mean, about the site, what does he ask? What does he say, Emma?
What the question that the doctor asked to the patient, or what the
Yes,
question?
Exactly, what the doctor asks the patient.
Where is the site of pain? Can you characterize characterize the pain, or where the pain is radiated, I think, and what association you come from, or what hospital you come from before you come to me when we take the patient history, and what is the time you get sick, and also that's all.
You just said several questions, yes?
Yeah.
So about the first the first questions that the doctor should ask, and you, as I can see, stopped with timing, and about exacerbating and alleviating factors. What are the questions, Yasmin? What is the question about this?
Yes, what's more pain is worse?
And about severity?
How we can treat or how we can solve this problem?
Yes, so this is a question that the doctor can ask himself or herself, because this is his job. Okay.
How can I help you?
Sorry?
How can I help you?
Okay, how can I help you? I think this is also the first question that the doctor asks a patient when the patient comes to him. Well, actually, the questions are, you can see the questions here on this slide, and you can see that about the site, where exactly is the pain? So where? So about the site, it's obvious. Onset, when did it start? Was it constant, intermittent, gradual, sudden? So, for example, did it start gradually or so suddenly? About the character, what is the pain like? Sharp, burning, tight, dull, etc. About radiation, does it radiate or does it move anywhere, any part of the body? Associations, is there anything else associated with the pain? For example, sweating or vomiting. Timing, does it follow any time pattern? How long did it last? Exacerbating our elevation factors, does anything make it better or worse? And about severity, how severe is the pain? Consider using the 1 to 10 scale, for example. So here are the questions that should be asked by the doctor following the Socrates model. Socrates. Okay, so I think we can